Welcome to the Health Stuff You Need to Know podcast. Information you need to thrive in our toxic modern world. I'm your host, Scott W. Kirkland. I hope you're ready because it is go time with the Wellness Whip. Yeah! Welcome to episode 12. And this is a listener's digest episode where I take media. It could be a podcast, it could be a documentary, it could be a blog. I take that information, distill it down to give you even more great health information faster. That's the idea. Just before we get started here, I'd like to give a shout out to Carpono, who gave me a review on iTunes. He said, Scott is passionate and enthusiastic about health and wellness. He brings a unique perspective as he disseminates current information and understanding on this complex subject matter. So thank you very much, Carpono. And thank you very much, everyone who gives me a review on iTunes, because it really helps me rise in the rankings. So please take the time to go and do that. I would greatly appreciate it. And plus, you will get a shout out if you do it. Alrighty, the first piece of media I'm going to digest for you guys is by Dr. Dwight Lundell. He is a medical doctor, a heart surgeon actually, and he wrote a column, an article, and it is called What Really Causes Heart Disease. My mom shared it with me via Facebook, so I'll give a shout out to my mom. Thank you so much, Mom. It's a great article. Thank you for passing it my way, and I just want to say I think you are awesome. I'm so glad you're taking interest in your health and sharing it with your loved ones. So let's get into it. So Dr. Lundell is a thoracic surgeon. He's had over 5,000 patients. He's seen lots of arteries because he's performed lots of surgeries. Now, the first point that Dr. Lundell makes is that it's really hard for doctors to admit when they've been wrong, especially when they've been giving advice for decades. And so kudos to Dr. Lundell for coming out and speaking his truth now, despite criticism from his colleagues. So conventional wisdom for the last few decades has been that high cholesterol causes heart disease, and if you eat a lot of fat, you get high cholesterol, then you get heart disease, and you have a heart attack, and you get arterial sclerosis, which is disease of the arteries. So the whole point of Dr. Lundell's article is that is not true information. It's actually inflammation that causes heart disease, not high cholesterol. So for many years, and even currently, the standard wisdom is that you should take statin drugs to lower your cholesterol, eat a low-fat diet, and that's actually not helping because the reality is that the rates of heart disease keep going up and up. So if that plan worked, we should be fine, but it's not. So it's quite clear that that is not working for us. Dr. Lundell says that dietary recommendation, that low-fat diet, has led to our current epidemic of obesity and diabetes. And I can see how that's true because we've taken out the fat and we replaced it with refined carbohydrates and refined sugars, which is really the reason why we're getting this chronic inflammation that's causing the disease. So Dr. Lundell explains how chronic inflammation really is the issue with heart disease. In the article, he uses the analogy of if you were to take sandpaper to your skin and rub it over time, and you know it's going to get raw and nasty, and that's what happens to your arteries when you're consuming too much sugar. Now, normally cholesterol will flow freely through your body without an issue, but when you have an area of inflammation, that's when the cholesterol gets trapped and it starts to go to those injury sites in your cell walls, your artery cell walls, and it collects, and that's when you start to see this clogging. So the real important to note, it's not the cholesterol that's causing the problem. It's actually this chronic inflammation that this cholesterol is getting stuck and trapped on. Dr. Lundell goes on to explain how your body's natural cycles of inflammation and healing are perfect in the way that they work. You have an injury, it causes inflammation, it sets off your immune system to come and help deal with the problem. But the issue with today is that the inflammation is no longer just like a simple event and then it gets dealt with. What we're having is chronic inflammation because we're eating this crap daily. So we're getting this chronic injury, and that leads to the chronic inflammation. That's what's changed in our lives. So now is a direct quote from the article, and it is, "The injury and inflammation in our blood vessels is caused by the low-fat diet recommended for years by mainstream medicine." He goes on to say that the biggest culprits of this chronic inflammation is the overload of simply highly processed carbohydrates, such as sugar, flour, and all the products made from them, and the excess consumption of omega-6 vegetable oils like soybean, corn, and sunflower that are found in processed foods. It's important to understand that our diet has changed dramatically. We're getting way more omega-6 fats than we used to. We should have a nice, simple ratio, usually 1-to-1, 1-to-4. Depends on who you ask, but that's a pretty fair assumption. Nowadays, we're seeing ratios of omega-3s to 6 of like 1-to-15, 1-to-35, 1-to-40, so way out of whack. A good analogy for the omega fats and inflammation in your body is that of a car. So you can think of the omega-3s as the brake pedal on your car and the omega-6s as the gas. You need both pedals to drive the car. What's happening now is that we're getting way too much gas and we're getting way more inflation than we should have, which is a big part of the chronic inflammation. So when you combine this way overload of the omega-6s that we see in processed foods in particularly, and this excess consumption of sugar and refined flours, it's no wonder that we're seeing this dramatic rise in heart disease. Dr. Lundell also talks about the rise in carrying around visceral fat. So there's a big issue with this extra weight that we're carrying around because your fat acts like a endocrine system and it releases pro-inflammatory molecules as well. So you're adding even more inflammation to your body when you're carrying around that belly fat. Dr. Lundell makes the point that the more that we eat processed foods, the more we trip this injuries, this inflammation cycle daily, day by day, and the more likely that we're going to get heart disease, the more likely that we're going to get diabetes, even Alzheimer's disease, high blood pressure. Dr. Lundell then talks a bit about solutions that help us lower the inflammation in our body. We need to eat foods that are closer to their natural state. We need to build muscle and eat more protein. We need to choose carbohydrates that are very complex, such as colorful fruits and vegetables. We need to cut down on our consumption of omega-6 fats like corn and soybean oil. So if you have those in your kitchen, you just go to your cupboard right now and toss them in the garbage where they belong. Dr. Lundell recommends using olive oil instead or butter from grass-fed cows because the omega-3, omega-6 ratios are going to be where they are supposed to be. Dr. Lundell goes on to say that the science that saturated fat alone causes heart disease is non-existent, and also that the science that saturated fat raises blood cholesterol is also very weak. So the good news is that we no longer need to be afraid of saturated fat, which is great news because I like my butter. All right, so that's going to wrap it up for my digest of that article. There is a link to it in the show notes, so if you feel like reading the whole thing yourself, by all means, go ahead. It is certainly worth your time. Today I'm going to shift gears a little bit, and I'm going to talk to you a little bit about my own personal health habits and the concept of using antidotes. So it's just something that I do personally, and maybe you might be interested in trying it yourself. So as you all know, I'm big on living a healthy lifestyle, but the reality is sometimes I like to do things that are not necessarily in my best interest as far as health goes, but they are as far as having pleasure. Now, there are people out there who are very pious in their diet, and God bless them, but I am not one of them. I eat really healthy most of the time, probably 95% of the time, but I do like to indulge. Because in my mind, I think part of the reason that we are here to live is to actually enjoy ourselves. So if we're too busy just trying to be healthy all the time and we're not happy, that doesn't really work either. We got to find a nice balance. So what I like to do when I decide to make the choice to be not so healthy in my dietary choices, I incorporate antidotes to help mitigate the harmful effects of the things that I should not be eating. I'll use the example of when I go to a restaurant, which is not very common, but every now and again I do go to a restaurant and I like to indulge. So when I go to a restaurant, I like to take certain supplements to help mitigate the harmful effects. These are the antidotes. So a prime example is I like to take activated charcoal. So what activated charcoal is, it grabs toxins. Because when you go to a conventional restaurant, the meat isn't organic. There's very likely to be processed foods in the meal which contain chemicals. So by taking the absorbents I'm trying to capture the toxins before they can pass through my gut wall and into my bloodstream. Activated charcoal is very effective at doing this. In fact, it's used in the hospital setting for when people have overdosed. It's very effective at grabbing those toxins and binding them up and taking out of your system. Another issue when you're eating out is the exposure to free radicals, which are chemical compounds that are highly reactive, and they float around in your bloodstream and basically gum up and make a mess of your healthy cells. You find a lot of these free radicals in food that's been grilled because that grilling process, the fat's getting burned and it's getting charred, and it's creating these carbon molecules that are free radicals. Particularly with barbecuing, we see a lot of free radicals being produced. You also find a lot of free radical production in deep fried foods. Deep fried foods are particularly bad because you're getting the free radicals. You're also getting rancid fat because these, like say you get some French fries or some onion rings and they're fried at high temperature and rancid oil. Lots of times that oil is like soybean oil or corn oil, which is genetically modified. Not good. And also has the high omega-6 ratio. So there's multiple factors for the reason why you don't want to eat fried foods. That being said, I have a bit of a penchant for onion rings from time to time. So I do indulge. The antidote for me is that I consume powerful antioxidants. You can think of these compounds as garbage men in your bloodstream. They go around and they soak up those free radicals and neutralize them. So they are great to have. So what I do personally is I actually make a mixture of cinnamon and turmeric and black pepper, which I encapsulate and then consume whenever I go to a restaurant meal. Cinnamon and turmeric are both excellent antioxidants, just jam-packed with high-powered antioxidants, so highly recommended. They also help control blood sugar, which I will talk about in a minute. I bought an encapsulating machine. It's just a little plastic thing, and then you buy the gelatin capsules that I fill with whatever I want, such as the cinnamon, turmeric, black pepper. And then I keep them in a tin. It's actually a candy tin. And then I bring it to the restaurant and I just consume it when I have my meal. I realize that's pretty hardcore. Not everyone wants to go that far. But if you go to your local health food store, you can buy turmeric preparations that are great. You're going to get a nice high dose of antioxidants, and it's very convenient. I encapsulate my own because it's a bit cheaper, and I'm a pretty thrifty guy. Another issue when eating out is exposure to sugars. So when you eat refined sugars, you can get these blood glucose spikes that can cause free radical damage, inflammation in your arteries, and force your body into fat storage mode, which I don't think anybody really wants. Now, most of the time I do try to resist and skip the dessert, but every now and again I get suckered in. I have a weak point for Mississippi mud pie or cheesecake. Luckily, there are ways to help mitigate those blood sugar spikes. There's things you can take that help keep it from ramping up. And cinnamon is one of them, and so is turmeric, as I had mentioned before. So excellent. You get powerful antioxidants and blood glucose regulation. Another thing that really helps keep your blood sugar levels where you want them to be is fiber. So I'm pretty hardcore. So before I go to the restaurant, I'll have what I call a fiber bomb. It's a mix of ground flaxseed, hemp seed, and chia seeds, and I mix it up with an immersion blender. This way I get a nice big healthy dose of dietary fiber, healthy fats, antioxidants as well. I realize this isn't very practical for most people, so a good option would be to take PGX capsules, which are essentially a high-performance fiber preparation made primarily out of cognac root. And fiber is also excellent at helping you get rid of toxins in your body. I like to use the analogy that antioxidants are the garbage men in your bloodstream going out and picking up the garbage, but the fiber is the garbage truck that takes the garbage and helps you run it through and get it out of your body and down into that toilet bowl where it belongs. The last supplement that I take when I go out to the restaurant is spirulina, which is a high-powered, nutrient-dense superfood, which is really good at aiding your body in its detox functions. The great thing about adding this superfood is that when you go to a restaurant, most of the food you're getting doesn't have a lot of nutrition in it. So it makes a lot of sense, I think, to consume some superfood to help give you that nutrition that you would have got if you actually ate a decent meal. It's also a good idea to take a whole food-based multivitamin to get those nutrients that you would have got if you hadn't gone to a restaurant. So I'm just going to recap that to make it nice and easy. Activated charcoal to help grab up those nasty toxins. High-powered antioxidant like a turmeric preparation. I like to use cinnamon as well. Give your body those garbage bins that can go and soak up those nasty free radicals. Throw in some type of fiber source. Like I do, I make my preparation, but PGX is going to be very convenient for you. And also some spirulina to aid your body in the detox process. And as I said before, I just take my capsules, I put them in a candy tin. That's nice and convenient, and I take it to the restaurant with me and swallow them down. So it makes me feel better knowing that I'm doing something to help mitigate the damage. And I still get to indulge and enjoy my little vices. Now, it's not uncommon when I go out to a restaurant to enjoy a nice frosty pint of some local brew. And all the supplements I mentioned before are helpful in mitigating the harm from that. Because when we consume alcohol, there's a few things that happen in the body. You're looking at free radical production, so you want your antioxidants. There's toxins, because when alcohol is produced, the fermentation process is not exact. Vodka is the cleanest of all the alcohols because it's highly distilled, and there's very little of the fermentation end products in it. Whereas with other alcohols, beer is on the other end of the spectrum. It has tons of these fermentation end products that are not good for you. Another issue with alcohol is blood glucose spikes because alcohol behaves in your body just like sugar does. So fiber, turmeric, cinnamon are all good things to help mitigate those spikes. And of course, one of the major issues with alcohol consumption is dehydration, because when you consume alcohol, your body stops producing antidiuretic hormone, which causes you to lose water. So it's very important when you're drinking alcohol to consume lots of water to help make up for the losses that you're taking. I would make the argument that if you wanted to choose a healthier alcohol option, that vodka and a pure real fruit juice would probably be a pretty good bet, because the good vodka has very little fermentation end products, and if you're consuming it with real juice that has vitamin C in it, it's going to give you that extra antioxidant boost that's going to help you out. Now, gin is also a good option because gin essentially is vodka, but with botanicals added, and it's possible that these botanicals may actually help your body. Try to avoid drinks with sugar and dyes, and beer is not a good option, but I have to admit I love beer and I can't help but to indulge every now and again. All right, well, that's going to wrap it up for this episode. There was a lot of good information there. I hope you take it to heart. It's one thing just to listen, but it's another to actually go out and do these things in your life. I hope you do, because I truly want to help people live healthier, happier lives. So please eat more real food, eat more vegetables, and when you do indulge in the crap, take the antidote. If you're going to take the poison, why not take the cure with it? We have reached the end of this episode. I hope you have found a piece of information you can use to improve your life or the life of your loved ones with. If you feel that I've helped you in some way, I ask that you help me in return. Liking, rating, reviewing, sharing, and or subscribing all help me rise in the search engine rankings so I can reach and help even more people. Subscribing being the most important one. Thanks in advance. As always, I will continue to bring you the health stuff you need to know.